I've been working as a counsellor and psychotherapist since 2001. I have I mostly work with individuals, couples, and families, mostly doing face-to-face work, but also some telephone work and online work. I've got quite a few qualifications, including a master's degree, and I work with general mood and behaviour dysfunctions or problems, and this would include the problems that people face in day-to-day life today in our societies: depression, low mood, self-esteem, addiction, alcoholism, feelings of despair, worry, anxiety, all of these sorts of things. I started training, as I said, around about 2000, 2001, and it's involved many years training, 4, 5, 6, and I'm still involved training, and I'm now a senior accredited member of the British Association for Counselling and Psychotherapy, which is a very long-winded term, but it's a pretty large organisation. I'm a registered UK CP therapist, and I'm a member of the Federation of Drug and Alcohol Professionals and the Association of Family Therapy. So I belong to all those organisations. And during my training, I did various diplomas and trained in all sorts of different types of working, including family and couples work, which I do quite a lot of, and addiction work, which I do a lot of. One of the challenges, perhaps, of counselling and psychotherapy is that it's not always easy to recognise immediate outcomes. So people often come to counselling and psychotherapy, and it can be quite a slow process. Sometimes I work with finding solutions to problems, and I help people to do that. I don't give the solutions, I don't give the advice, but also it's around exploring how people have got to that place where they're facing these issues or problems. Regarding outcomes in counselling, quite often people come for counselling around alcohol or bereavement or loss or confidence, and in a way you can measure that outcome, because after a period of time they might feel more confident, or they might have got over some anxieties, or stopped their drinking or their drug use. What you can expect on any sort of face-to-face contact with me or any telephone contact with me is going to be a neutral space where you can talk to someone who's going to listen to you properly, and by that I mean hear what you're saying in an empathic a non-judgmental way. And in counselling, psychotherapy, or perhaps even with telephone advice, that in itself can actually just give you that little bit of a lift that you need to boost your self-esteem, or to feel perhaps that what you're going through is quite normal and part of being human. I work with adults, young people, and I work with families with young children. I also work with couples, and often the couples that I see are quite new parents, and I'm quite at home with people bringing their babies along, and all the toddlers, and letting them play in the room whilst we play, if you like, with the psychological and the emotional. So I work across all age groups, really. My experience has been very diverse. When I worked in organisations, I worked with black and minority ethnic groups. I've worked in places like victim support, the Refugee Council. I've worked in prisons. I've worked in addiction programs. I've been program manager and senior therapist. So I feel I've got a lot of life experience to bring, and a lot of experience working as a psychotherapist and as a counsellor in supporting people from all areas of life. I think I'm passionate about my work, because over the years I've seen so many people who have come facing quite deep despair, or some really devastating kind of problems, as well as the people who may be just feeling a bit down. And it's great to see them working hard on themselves and wanting to make change, rather than necessarily just coming along and if you like, moaning about it. What I try to do is I try to encourage the person to want to make change and to find a way to do it. And I think nowadays I have quite a philosophical approach to my work, which is based on a humanity, if you like, that most people do want to better themselves. And I think if I could be part of that, I find it very rewarding.